मूकं करोति वाचालं पङ्गुं लङ्घयते गिरिं यत्कृपातमहं वन्दे परमानन्दमाधवं वागर्थाविव सम्पृक्तौ वागर्थः प्रतिपत्तये जगतः वितरौ वन्दे पार्वती परमेश्वरौ. Good morning, one and all. First of all, let me remember the Almighty Gurus and my dear Ayurveda followers. Today, we are going to have the online live discussion on the clinical aspects of Srotodushti or clinical understanding of Srotodushti. How we are going to learn based on the concepts of physics, chemistry, and biology. So, before going into that, so let us have some of the discussions related to the concepts which we need by heart or which we need to understand. First of all, if you know about the physics, chemistry, and biology and Ayurveda fundamentals, then any of the concepts which are being explained in Ayurveda can be learned with the best understanding. This can be further dissected in the following manner. First of all, we have to practice the concept of minimalism. What is the word meaning of minimalism? Take one small topic. That means let us assume the concept of dosha. We have to learn in the context of Rachana Sharira, in the context of Kriya Sharira, in the context of Roga Nidana, in the context of Samhita Siddhanta, Kaya Chikitsa, in the context of Agadha Tantra. So, like that, in each and every aspect, we have to learn that particular concept. Then we can have a deep dive understanding of the concept of dosha. Similarly, if you are looking, apply the concepts of physics, apply the concept of chemistry, apply the concept of biology, etc., then even we can have a deeper understanding of the concept. Third aspect, that major thing, that is whenever if you want to have a Ayurveda understanding better, first of all we need to have the each and every corner of Kriya Sharira. That is what is considered by Ayurveda physiology. So when you know about the Ayurveda physiology, then we can have a better understanding of a Ayurveda pathology. Then, when you are knowing about the each and every corner of a Roga Nidana or Ayurveda pathology well, then learning Kaya Chikitsa is very, very easy. It is not at all a difficult thing. That is what is called the Ayurveda internal medicine, what we can say. Next, whenever what is the main motto of this particular channel, or what is the main motto of the academy? That is, and even the main motto of learning Ayurveda also, that is pattern identification. What is the word meaning of pattern as such? Pattern are nothing but the repeatedly occurring observations or repeatedly occurring events. If we know about, suppose if one person is taking the, for example, the Disevana for a period of the 10 days or 12 days, amount is something around 300 ml. In that particular situation, naturally, and if it is having sore taste, naturally, when you look into that, continuously, if he is doing 10 days, that means 10 different observations are there, 10 different events are being happening. But the thing that is going to happen is Pitta Dosha Vishesham. So, in that particular situation, what we need to do? We need to know about the subsidence of Pitta in the sense, first of all, stop that particular sore curds intake. Instead, you have to go for something else. So, that will be responsible for the remission of Pitta or decrease of the Pitta dosha in the body. So, that is whatever may be the concept. First of all, try to identify the pattern, then so that we can modify the pattern and we can create our own pattern, so which may be helpful in so restoration of health or the deviation or whatever the desired thing we can able to achieve. No compromise will be done in learning the Ayurveda fundamentals. And one major thing, whenever if you are learning, follow one particular mentor. Mentor in the sense the person who is doing something more than you. That means if you follow one particular mentor, so suppose if you follow one particular mentor for three different uh, observations or three different occasions, you can able to identify what he might have said in the past and what he is saying today, what he might say in the future. Even that can be connected very well. So that is the reason, and your knowledge will be moving to a next level if you are doing this particular manner. So that is why follow one particular mentor. And the major thing as such, whatever how you are going to learn the Ayurveda information better. So here there is a railway track is there on one side, so the railway track is moving and on the other side is moving again. So that means you have to follow the Ayurveda information through the Ayurveda point of view, and you have to follow the Western information from the Western point of view, and try to connect at to different levels. If you are able to relate these two informations at different level, then it is indicative that you are moving in the right direction. So that is why you have to connect at different levels, so that we can have a better understanding of Ayurveda. And whenever if you look into that Ayurveda, you have to look it like learning like a new language. That means how you are going to learn the new language. Most frequently used words we are going to use first. The next frequent used words we are going to learn next. So like that, less frequent words next. And you are going to apply as soon as you are learning that. That is what learn, do, and teach. So that particular principle we are going to apply. Now coming to the concepts of dosha as such. Uh, Yes, Ayurveda says these two informations. Still, there are some more informations are there, but I am going to discuss only these 2 points. Sravanat Srotamsi. It is being mentioned there. And Srotamsi khalu parinama apadyamananam dhatunam abhivahini bhavanti ayanarthena. Now, how we are going to apply? So, in this particular the small image, so that I have shown here. So here, this is an schematic representation of a Srotas, which is having Srotomula A and Srotomula B, which has 5 different organs 1, 2, 3, 4, and 5. And here the image depicts the movement happening in the Srotas, that is from the A to B, not from the B to A. In that particular situation, so here there are 3 different events are there. That is where the entry of pathogens are possible. So first entry is happening through the A. That means the entry is happening in the direction of movement of the Srotas. That means they definitely you are going to get the symptoms in the one, and in due course certain he may have the symptoms in 2, in 3, 4, and 5, and lastly the person may have the symptoms even in the Srotomula B. So here the Srotomula 1 is having the Srotomula A, that is having the one organ as its Srotomula, and Srotomula B is having the 5 as the Srotomula. So that means if an entry is happening at the A, 1 may be initially afflicted, but 5 may be afflicted later. Let us assume if an entry of pathogen is happening in the Srotomula B, and movement is happening, that is the movement in the Srota is happening from A to B. Naturally, we may not get the symptoms in the 4, 3, 2, and 1, because it is moving in this direction, the reverse direction. That is why the affliction you may get you only in the 5, not in 4, 3, 2, 1. Whereas, let us assume there is an pathogen is entering in the 2. In that particular situation, symptoms may be observed in 2, 3, 4, and 5, but not in 1. The symptoms may be observed. Of course, it may happen, but it may take much later, much due course of time, because entry is happening in the 2. So this one we can able to learn in the best way is respiratory system. If the person is having the entry of pathogen in the nose, initial affliction we can see in the nose only. So whereas the other one, that is the other way, that is Hridaya. If Hridaya is being afflicted, so that means the affliction may be observed initially in the pulmonary capillaries. From there, alveoli may be afflicted there. Whereas, let us say entry of pathogen is happening in the mouth. So that is in that particular situation, symptoms may be observed in the mouth, not in the nose. So like that, So we can able to understand the concept of Srotomula. Coming to the regarding the main path, the aspect, that is distribution of blood in the cardiovascular system. Whenever if you look into that, the human body is comprising of 10 billion capillaries. 1 billion is equal to 100 crores. So that means 10 billion capillaries, in the sense the human body is having 1000 crores of capillaries itself. And when you think about the whole human body, it has 50 trillion cells. That means 1 billion. That means the 1 trillion cells is equal to 1000 billions. Or otherwise, 1 trillion is equal to 1 lakh crore. That means human body is having the total number of cells 1 lakh crore into 50. Look into that. When you think about it, so this number of capillaries much lesser. So when you think about whole distribution of the blood in the cardiovascular system, suppose if the human body is comprising of 100% of blood, so 7% of the blood is present in only in the capillaries, whereas the 9% of the blood is present in the pulmonary circulation. So, and nearly around 64% of the blood is present in the capillaries, in the veins and venules and venous end of the capillaries. Whereas the arterioles, they contain around 7% of the blood. So that means when you say about it, the blood is not present throughout the capillaries at a particular time period, throughout the cardiovascular system at a particular time period. In that particular sense, when you say about pumping of the blood from the left ventricle, it may be around 70 to 80 times per minute on an average. But when you come to the capillaries, so the movement of the blood is happening in the capillaries only in up to one or twice per minute. This is the movement of the blood is happening in the capillaries. So when you think about the capillaries as a whole, so here this is a source of guidance physiology. So this will be in microcirculation that may happen there. Suppose if there is any pathogen is being present, so here there is a screen colored image that is showing a small pathogen in that. So this is actually attracting the more number of the blood towards that particular capillary. So that means this is responsible for the movement of the WBC, etc., from this particular capillary into the particular interstitial space. And at that particular time period, what actually happens is this will be blocked. Why? So we will be coming into that in the coming session. So thereby the blood may move the alternative route, and from there it will be entering into this with the help of what you say that the chemotaxis. These in the inflammatory markers, that is the because of the presence of the inflammatory markers, because of the entry of the pathogen in this particular region, this may be responsible for the movement of the uh, certain cytokines or otherwise the WBCs, etc., into this particular cell, in this particular area. So like this is the nature of microcirculation there. Why this microcirculation will happen? So what actually happens in that? So that is, we need to know about the Stirling forces. So Stirling force is nothing but these forces which are acting across the capillary membrane. So that is being actually exerted by the water, proteins and electrolytes. So the water portion present in the capillary is responsible for the hydrostatic pressure, whereas oncotic pressure is actually exerted by the proteins and electrolytes present in the particular capillary as well as interstitial space. So now let us look into the actual Stirling forces concept there. What actually Stirling forces refers to? So here this is an image that is showing the small capillary. Suppose if this is a capillary, if this is the interstitial space, if this is the movement of the blood is happening from the artery to vein in that particular situation, so the water present in the capillary, so that is responsible for the movement of the blood or fluid from the capillary to interstitial space. Whereas the oncotic pressure, that is responsible for the reverse movement of the blood. That means it is exactly doing the opposite function of the hydrostatic pressure. Whereas the venous end also, that is a hydrostatic pressure as well as oncotic pressure. As the presence of the contents of the capillary most of the occasions is constant throughout the capillary, the oncotic pressure will be almost the same throughout the capillary. Whereas the hydrostatic pressure may differ, because when the blood is moving from the capillary, the amount of the water portion present in the capillary will be much more. Whereas at the venous end, the amount of the water portion present in the capillary will be lesser. Why? Because the some amount of the water portion will be moving from capillary to interstitial space when this during the uh, total Stirling forces action at the arterial end of the capillary. Whereas the venous end of the capillary, because of the less amount of the portion, this the whole content at the venous end, that is becoming much thicker, right? And this is what is considered to be the tissue tension. That is nothing but the hydrostatic pressure of the interstitial space. Whereas the other one, that is oncotic pressure, that is exerted by the proteins and electrolytes present in the interstitial space. If you look into that, the whole movement, so this is about the total value that can be given to the different Stirling forces that is acting across the capillary membrane. Suppose if the blood pressure is of the body at the heart level, it is 120 by 80 millimeter mercury. This may be the value that can be given to the Stirling forces. That hydrostatic pressure at the capillary, at the arterial end, will be around 32 millimeter of mercury, whereas oncotic pressure throughout the capillary, it will be around 25 millimeter of mercury, and the hydrostatic pressure at the venous end, it will be around 12 millimeter of mercury, and tissue tension it will be around 4 millimeter of mercury. That is hydrostatic pressure of the interstitial space, whereas oncotic pressure at the interstitial space will be around 8 millimeter of mercury. Whereas the total movement at the arterial end, it will be around, if you are adding this, so it is around 11 millimeter of mercury. That means with that amount of the pressure, the fluid will be moving, or nutrients will be moving, gases will be moving from the artery to interstitial space. Whereas the at the venous end, what happens is, sorry, at the venous end, that will be the this much amount of pressure, that means minus 9 millimeter of mercury, the whatever the movement is happening, that is from the interstitial space to space, that is happening there. So here the minus, that is indicating the movement, that is reverse movement as that of the arterial end of the capillary. So if that is happening, so this will be the mechanism of the what do you say, that the total blood, the consistency of that may happen. When you think about, this is an image, the right image, that is showing a milk. So which is considered to be the consistency of the blood present in the either in the arterial end or the what do you say, that arterioles, etc. Whereas when the blood is moving through the venous end, the consistency will be like honey or curds. See, the arterial end, the consistency will be come, that is the very thin, whereas when it is coming to the venous end, that is responsible for the thickness of the blood in the venous line because of the movement of the fluid. That's the reason, and this is the reason for most of the mechanism of Srotodushti to happen in the body. And think about the Srotodushti patterns. The text says, Ati pravritti sango vasiranam granthayopi va vimarga gamanam chapi srotam dushti laksham. So when you think about it, so these are three different mechanisms that can happen in the arterial end of the that is happening in the Srotas. Let us assume so this is considered to be ati pravritti, and so this is considered to be the Siragran, that is the Sangha and uh, Vimarga Gamana. And this is considered to be Vimarga Gamana itself. And this may be considered to be Siragranthi. If you consider this, this is considered Ati Pravritti and this is considered to be the Sangha and Vimarga Gamana. This is considered to be Vimarga Gamana and this is considered to be the Siragranthi. When you think about it, so let us assume Ati Pravritti in terms of alimentary canal. Suppose if this is an alimentary canal from and this is considered intravascular compartment which is attached to the alimentary canal, and from here only the fluid that is moving into the interstitial compartment, and from there whatever the nutrients that will be moving into the intracellular compartment. So now let us look into the alimentary canal itself. When you think about it, so most of the occasions what actually happens is Ashyashana, Vishamashana or Viruddhashana, and still some more are there, but for the time being I am looking into Ashyashana and Viruddhashana. Think about it. So whatever may be the case, the accumulation of the food will be happening in the stomach. That is the reason. So most of the occasions, the person may have the appearance of the infection happening in the stomach. Why? Because of more amount of the time that will be required, that is present for the storage of the food in the stomach. But the same thing, mouth and esophagus, the infection may not be evident as the stomach, small intestine, large intestine may have. Why? Stomach, the storage of food may be there for a period of 2 hours, whereas in the small intestine, the presence of food may be present for the period of 6 hours, whereas in the large intestine, the presence of the what do you say that the food in the large intestine that may be present for a period of 24 to 48 hours. Whereas in the mouth, that is only a period of 2 or 3 minutes, and in the esophagus, it will be around in a matter of seconds. That movement of the stasis of the blood may be observed there. And most of us are taking the carbohydrate-rich diet, so the microorganisms they proliferate very rapidly in the carbohydrate-rich diet. So that is the reason the infections are possible in small intestine, large intestine, and stomach also. Whereas in the mouth also there is a possibility if the person is not taking care of proper oral hygiene. Infection may be possible even in the mouth also. So this is how, and when you think about the Adhyasana and Viruddhasana, so this is responsible for the inflammation in the sense what? So this is responsible for increased secretion to happen into the stomach through the intravascular compartment, which is supplying the blood to the stomach area. So which in turn responsible for the what do you say that the dilution of the hydrochloric acid. That means the acidity of the gastric juice will get reduced. That is, it is moving more towards the alkalinity. So that means the pepsinogen, which is being secreted in the stomach, that cannot be converted into pepsin. So that means whatever the food that is being consumed, which are in the macromolecular form, that cannot be converted into intermediate or micromolecular form in the stomach. So in that particular situation, what actually happens? Inflammation has already happened. Increased secretions are also there, which in turn responsible for the increased peristaltic movement. When there is increased peristaltic movement is happening, which is responsible for the poor absorption and assimilation. So when there is poor absorption and assimilation is happening, so this is responsible for the increased fluid loss from the alimentary canal. When there is increased fluid loss, that means normally around 5 to 8 liters of the fluid that is being secreted in the whole alimentary canal. When it is increased fluid loss is there, this is going to get reduced. So that means the person may have water loss, the person may have electrolyte loss also. Electrolytes, which are the main electrolyte that is required, are the sodium, potassium, calcium, all these are going to get eliminated via alimentary canal. And even then, the nutrients that will be getting lost from the alimentary canal. And whenever there is inflammation is happening in the alimentary canal, this is leading to the secretion of inflammatory, that is the markers, that is nothing but the proteins to be present in the stomach, which is the reason for the increased secretion to happen in the fluid there. It's so from the intravascular compartment to the stomach. Whereas the aftermath of 2 hours later, etc., these fluid, that is the content in the present in the stomach, that may move in the small intestine, the same mechanism that can happen. If the same thing after a matter of 6 hours later, if the fluid is or the nutrient is moving from the small intestine to large intestine, the same thing, same mechanism can happen. Suppose if the stomach is perfectly normal and the small intestine is having the disease pattern or the manifestation of disease, then these same procedures, inflammation of the alimentary canal, etc., that can happen in the small intestine, but the stomach may show perfectly normal function there. This is how we can able to learn about the atipravritti. Atipravritti, that is actually happening in its own pattern. That means, suppose if they from the mouth to the anus, there is a movement is happening. So ati pravriti refers to the movement of the any kind of the contents from the same natural course. From the body to the exterior, the anulomana is happening. Then the third thing, that is in case of females, the excessive menstruation. Again, all these are considered to be the examples for ati pravritti. Whereas the reverse movement from the stomach to the mouth, that is vomiting, it is not considered as atipravritti. Why? Because it is in the reverse direction. That's not in the natural course. That is why it is considered to be not an example for atipravritti, vomiting. The examples are atisara, prameha, and the atyartava. So these could be the examples for atipravritti. Coming to the sangha. When you think about the sangha, so this means the stresses of any of the contents for a certain time period. So when you think about the Adhyasana, we have given the earlier example, or Viruddhasana, the naturally Sangha will be occurring at the pyloric antrum, specifically for a period of 2 hours. So when this 2 hours, that means which may be the breeding place for the microorganism, because carbohydrate rich diet we are going to consume, and the stasis of the food is happening in the pyloric antrum for longer time, and there will be decreased, what do you say, that the gastric juice. Gastric juice contains hydrochloric acid, pepsinogen, mucus. When this is going to get reduced, naturally the microorganisms which are going to get destroyed by normally hydrochloric acid, that is going to get diminished. That is how the person may have the development of infection that can happen. So this is responsible for the reverse peristaltic movement there. When the person is consuming the food again, adhyashana, frequently, so this is actually responsible for the pyloric antrum closure still much longer time. So as the pathogenesis is there is the gastric mucosal damage has happened, which is resulting in the increased proteins in the stomach, thereby more amount of the fluid that will be coming from the intravascular compartment to the stomach, which is responsible for the increase in the size of the stomach. So this is responsible for the movement in the reverse direction. That is, reverse peristalsis may happen and the person may develop vomiting. Whereas Vimarga Gamana, in that way, that can happen there. Because as Sangha has happened, that is Vimarga Gamana may be also be happening. So that means whenever there is a Sangha, that is necessary to have a Vimarga Gamana. That the deviation from natural course or the reverse movement because of complete obstruction, this may be possible. That means when there is Sangha. Whereas Sira Granthi, so that means the when you look into the blood vessels, the centrally that is lightweight substance that will be moving. For example, the RBCs. From the periphery, the proteins that will WBCs etc. that will move. Still periphery, the fluid and electrolytes that will be moving. So as the molecular weight of the RBC is comparatively lesser, so that will be moving very faster. That will be moving in the center. As the WBCs that is having the slow, comparatively heavier molecular weight, that will be moving little bit slower. As the still periphery, the plasma proteins etc. that will be moving in still in the peripheral direction. So this is what is considered to be trilaminar flow. This may be present in most of the blood vessels. When there is any kind of the obstruction that happens, this may be the either there may be a trauma or there may be atheromatosis plaque. In that particular situation, what actually happens is this may be the phenomena. So the this may be the phenomena of movement. That will be a possibility of deviation may happen, so thereby the person may develop the what you say that the Sira Granthi, that's how this may be responsible for the decreased blood flow distal to this particular obstruction. So wherein this could be an example for Sira Granthi. So that means the take home message it could be Srotodushti is considered as the abnormal functioning of Srotas. So four types of Srotodushti are being mentioned: Ati Pravritti, Sangha, Vimarga Gamana and Sira Granthi. So, in a single individual, either Ati Pravritti may occur or any two Ati Pravritti or Sangha may occur. Ati Pravritti, Sangha or Sira Vimarga Gamana may occur. Ati Pravritti, Sangha, Sira Granthi and Vimarga Gamana. All the four, either one, two, or three, or all the four Srotodushti can be possible in a single individual. This may be depending upon the entry of pathogen. This may be depending upon the physical strength of the individual. This may be depending upon the virulence of the pathogen. All these are, and this may be even the nature of environment, everything that is multifactorial. These are responsible for the nature of this Srutadrushti occur in the human body. By applying the physics, chemistry, and biology, we can have a deep dive knowledge of Srutadrushti. And any concept can be learned with a deep dive method by applying the physics, chemistry, and biology application. So that's all for today. If you want to have any of these clarifications, so let me know. If there are no queries, then let me end the session, and I thank all the members who have attended this particular session. Uh, Thank you.